you guys like to get started? Panelists, would you like to get started? Okay.
Yes. Sure.
All righty. Attendees, good morning. My name is Mrs. Angela Hefter, and I'm the coordinator for the Health Careers Academy, and I welcome you attendees to the Salute to Youth. We have some remarkable people here with us today. I'd like to take a moment to introduce them. First, you have Mr. Jeremiah Johns. He's a registered nurse with Antelope Valley Hospital.
Hello, good morning.
Next, I have Mr. Dennis Anderson. He's a licensed clinical social worker with High Desert Medical Group.
Hi there, good morning.
Next, I have Miss Katie Godek. She's a registered nurse with Palmdale Regional Medical Center, and along with her is Raquel Ariola. She's a respiratory therapist with Palmdale Regional as well. Welcome, all of you.
Morning.
Thank you.
Good morning, good morning. I think what you'll see is, if you see on the screen my name in a block, that is my human resources colleague, is Stephanie Dorman from
Morning.
Resources Department at High Desert Medical Group, and she's here to answer questions that you might have.
Thank you. Welcome, Stephanie. We appreciate you joining us.
Yes, of course. Thank you for having me.
So we're going to go ahead and listen to some questions. So I'm going to start first with you, Mr. Johns. What was your career path to get where you are now?
It's a windy road, but one thing to note is that I didn't do anything special in high school. So in high school, you guys being involved in any of these medical academies is really putting you ahead of the curve as far as getting into healthcare. For me, after high school, I took an EMT course at University of Antelope Valley, and that's where it started. I worked as an EMT for several years while I kind of got introduced to the healthcare field. From there, I went to just our local community college, Antelope Valley College, and did their RN program, which is an excellent program and fits the bill for being a program that can be done pretty cheaply and stay locally to get your RN license. From there, I started working at Antelope Valley Hospital as a labor and delivery nurse, and then in the emergency department for a few years. And then I've been with the trauma program for about 5 years now. After I finished my program at AVC, I finished a bachelor's program online after that. And then I'm currently in a advanced practice nurse practitioner program as well.
Wonderful. That's exciting. I love that. We are welcoming Miss Isabel Covarrubias. Are you with us, Isabel?
Yes, I am. Good morning, everyone.
Good morning. Thank you for being with us. I would like to introduce Ms. Covarrubias. She's a registered nurse with Los Angeles County Department of Health Services. We've started with our panelists in questioning, so I will come right to you with a question if you're okay with that.
Yes, I am.
All righty. Mr. Anderson, can you please tell us what is a fun thing about your job?
One fun thing about my job is I get to interact with our patients at High Desert Medical Group. The fun thing, it's less that it's fun than it is extremely rewarding. When we have encounters with patients as clinical therapists, they usually have a problem that needs to be addressed starting at the first moment of encounter. They may be having suicidality, or they may be experiencing clinical depression. And what you're going to do as the therapist at High Desert Medical Group is interact with that patient to see what are their needs, how can they be helped starting at that very moment, and then to make sure that they get transferred to a level of care that's going to really help them. If they are in such a crisis that requires hospitalization, we help get them to a safe place like Palmdale Regional or Antelope Valley Hospital, where they have good mental health services to be sure that they are getting the care they need. So that's an intensely rewarding part of work that I do on site at High Desert Medical.
Exciting. We need that very, very much out in the Antelope Valley. All right, Ms. Godek, can you please answer for us, what is the relevant education and training for your profession and career path with your profession and also with Raquel's?
I'm sorry, was that for Isabel?
No, that was for Katie Godek and Raquel Ariola.
Hi, good morning. Yeah, so I am a registered nurse here at Palmdale Regional, and basic requirements are that you get your associate, ADN, your associate degree in nursing. There are some facilities that require a bachelor's in nursing as well. But I know here at Palmdale Regional, I'm not quite sure about AV Hospital, but an ADN will get you in on the inpatient side. If you do want to pursue for your bachelor's, I actually just recently got mine through online schooling, just like Jeremiah, through Chamberlain University. So there's several programs locally that you can go to get your bachelor's. And then of course there's online resources as well. As far as specific training, most nursing positions do require, whether you're inpatient or home health, hospice, whatever route you choose, a basic BLS certification. If you're doing the inpatient side, you have to do your ACLS, which is the Advanced Care Life Support, where you learn CPR and drug interventions and airway and so on and so forth. And then here at our facility, we have our annual skills lab that we do. We have CPI courses, which is it's crisis prevention intervention, which is like a de-escalation class. And depending on the unit, I know our emergency department requires additional schooling as well. They have to do PALS and some other training as well. So really it depends on which modality you want to go as far as nursing. There's so many different places that you can go with it. And based on your unit, there's some specific training that's involved as well. So.
Hello, Raquel. Respiratory is very similar to nursing. We need an associate's degree. You can get it through AV college, and you can also community college, and you can also get it through a trade school, which is a faster route that a lot of people seem to be taking. It's a lot more expensive. It's accelerated, and it's 2 years. Where if you go to like a community college, you need to get all your general classes and then be accepted into the program. So that can take a little longer, and that can take about 3 years.
Okay, Isabel, thank you very much. Isabel, can you tell the students what is a challenging thing about your job? Isabel, you need to unmute. Unmute.
Sorry about that.
Okay, thank you.
There is a lot of actually fun things about my job, but the challenging things about my job is I'm basically the patient care. When being too attached to your patients is one of the things. I have been in nursing for a long time. I am now a nurse recruiter out of the patient care area, and I do outpatient surgery center. I still am actively working as a nurse. So one of the challenging things that I encounter usually at the bedside in patient care is being detaching from your patients, not being, trying not to feel, not to have emotions at the time, and providing the support to our patients when they need it the most.
Thank you. Okay, this one's going to go to Stephanie Dorman, and Mr. Anderson, you can chime into this as well.
Sure, of course.
Stephanie and Dennis, can you tell us what is the best piece of advice you would offer a high school student who would like to be in your profession or job? So with Stephanie, with you being the human resources, you might want to explain what human resource option is, and then
absolutely.
You guys tag team.
I think determination and I'm eager to learn. You can come out of high school just a C student, just barely passing, or an A student. That's okay. I think just the determination and the willingness to want to learn. And you can start from the ground up. I myself started just as a receptionist and worked my way up to where I'm at today. So I think it's just the willingness to want to learn and want to work.
Yeah, thank you, Stephanie. I would add that at any time on the High Desert Medical Group.net on our website, that you can get a good look at what the careers are that are available.
Absolutely.
Typically, we need licensed vocational nurses,
Mhm.
RNs, and we have a team that actively recruits for physicians. But I would say that one of the great assets is a place like the Palmdale High School Academy for healthcare careers. It's a good place to get focused early. The other is that High Desert Medical Group has had for many years a lot of support for the Antelope Valley College nursing program. And we're very happy that the community college, as was noted by Katie, it's a lot less expensive and it may take a little more time, but this sort of is the state of California's investment in your future. I'm also glad to hear that Jeremiah got what he was looking for at University of Antelope Valley. In other words, you have a lot of academic solutions that will carry you to where you want to go. Usually what they require is, if I heard from Stephanie correctly, you don't have to be an A student to start, but you do have to be determined.
Correct.
And within the realm of that determination, I was a journalist for about 35 years and worked as the editor at the Antelope Valley Press, but I knew I wanted to do something that would be of assistance to veterans who are experiencing mental health problems. So I had to go back to school. And 35 years after getting a BA, I went to the master's program at University of Southern California, USC, for a master's in social work, where they do teach you clinical therapy methods, but they also teach you how to help people get off the streets, improve their quality of life, prevent homelessness. So it's a very versatile degree, but it requires a lot of focus. But the master's in social work programs are offered at Cal State University Bakersfield, at CSUN, and you can get a good start anywhere you want to go, starting at Antelope Valley College or College of the Canyons.
Mhm. Yeah.
Anything you want to put in there?
Yes, I just, it's such a bright future in the healthcare field, I think, and I think the possibilities are really endless. We encourage the high school students to go ahead and go onto our website and definitely check out what we have. We do have entry-level positions that may help them get there. We also do offer very rich benefits, and that's even education reimbursement. So that might be appealing to some of the high school students as well.
Thank you. Okay, we're going to probably close this here in a few moments, but I do want to give each and every one of you an opportunity to tell us, and we'll start with you, Mr. Johns, what is a fun thing about your job?
Yeah, I would say for me, I've kind of chosen a path where I'm working in what is, by all accounts, a very, very intense environment, working with trauma patients exclusively. So I would echo what Mr. Anderson said, which is that fun might not be the word, but fulfilling certainly is. And so for me, it's about having patients come to the hospital who are very literally on the verge of bleeding to death, and then working with a very multidisciplinary team, lots of different players that are working very hard and very quickly to do interventions, and then seeing those same people walk out of the hospital with their families, whether that's a couple of days later or a couple of months later, or sometimes we see those patients a year later. But being able to see that what you're doing to help people actually is helping people, it really is making a significant impact on people's lives, is very, very fulfilling. And there's fun to be had too, but that's the way I'd answer that question.
I love that. Raquel and Katie, can you tell us what's fun about your job?
I have to piggyback off him. We were just saying we're going to have to kind of piggyback off of Jeremiah. I mean, it's always very fulfilling when you see those success stories and you hear back from patients weeks later. But, another fun part of my position, I've had the opportunity to be a preceptor, and I've had the opportunity to train several nurses. And it's really fun to see their growth. It's really fun to see them excel and You know, I have nurses that I've trained that are currently going through nurse practitioner school. They've gone to other units, they've gone into the education side, and they've really just thrived in their careers. And it's really fun to see that you were some sort of part of that. And so, yeah, that's been really fun for me to see.
And I think for me, the fun part, very similar to Jeremiah as well as the outcome, but also is to work with my own community and to have a strong group in my department. And we just make the best out of it. We have fun in the department. When we go out there on the floors to take care of our patients, we're serious. And then when we come back to the department behind, you know, closed doors, we just try to make the best of it. And we're just like a family.
Okay, Isabel, you had the longest tenure as a nurse. So
Hi,
fun
everyone.
can be a lot of differences from when you started to what they are now. Do you have anything to add to that?
Well, I will have to agree with Jeremiah and Katie. I relate to that. I started in pediatrics back in my early days, and I actually worked in one unit and for at least 15 years. So I would receive the babies coming the next day after they were discharged from the hospital with their moms. And I actually got to see them grow. Actually, I was in one facility for 25 years. And I saw them, they always came back to say hello. That was 25 years of seeing them grow. So that was really fulfilling. Being able to wear multiple hats, working for LA County is really a blessing because there's a lot of career opportunities, advanced opportunities, promotional opportunities. We do have a lot of programs as well. We bring in nursing assistants. I started as a nursing assistant, you know, and I worked my way up to LVN in the same unit, RN, manager. So that has been really fun. I really enjoy doing everything that I have done for the community as well. So there's just so much I can tell, but I know I don't have a lot of time.
Well, thank you. Thank you all very, very much. We greatly appreciate this. We did have a couple of questions that came up from the students, but some of them are a little bit more related to the certificational sides and more job specific or industry specific in healthcare. So we've encouraged them to go to another session where they can be specific and on those questions. But I want to just tell the students that are listening, these wonderful healthcare professionals and the director of human resources, these people are expressing to you the value of what you can bring into your own community, and we need you to consider to do that. Healthcare is a very rewarding profession, as is education, and we need you as our future to look and see what you can bring into it. And I would thank all of these panelists. Your professionalism, your compassion, your desire to share the knowledge of what you have with our students is greatly appreciated. We want to thank each and every one of you for attending with us.
Ms. Hefter, if
Yes.
I could just add one thing closing, and that is people need to earn a living. And there really is a pretty high top in the profession. You can set goals. You can bring in a six-figure income. This is important to your family. It's actually also important to your community. And these are careers that have that potential.
Absolutely. Okay, well, I'm going to thank you all for now. Panelists, you will have another host the second session, and I'll probably see you with some of my students in that. All right. Thank you all very much.
Okay.
Thank you.